So, this is the second part of Warthins tumor. So, as mentioned is the first part, Warthins tumor is a benign condition and it is seen only in parotid gland. And we have seen everything about Warthins gland except for the treatment. So, the second part I will be concentrating only on treatment. So, the treatment is going to be surgery. So, let me tell you that parotid gland, it has got two parts, the superficial part and a deep part. So, this is a superficial part, this is a deep part. And in between that you have plane, you have a facial nerve, it goes through that. So, the Warthins tumor, it is seen in the superficial part. So, surgery is going to be removal of the superficial. So, since it is seen in the superficial part, only the superficial part is removed. So, that is termed as superficial parotidectomy. So, the decision has been taken that operation has to be done and you are admitted. First, we will take a concern from you. In that concern, hospital concern paper, on the top it will be written what is your diagnosis, followed by what is the operation that we are going to do and what are the complications related. Now, going through all this, you have to, the patient has to sign, write their name and date. Same thing will be done by the witness and the doctor also. So, let me tell you the complications of the surgery. The complications are, it may bleed during the surgery and it can bleed even after the surgery. If it so happens that even it bleeds after the surgery and we are not able to control by the bedside, we may need to take you back again to the theatre and we will open the flap, see where it is bleeding from, control the bleeding and bring you back to the ward. The second complication being, there can be infection, the wound infection. Third is, there is a possibility that the facial nerve can get injured. Maybe it can be temporary because of the heat of the equipments which you are using, which may last for a few weeks or 1 or 2 months. Or it can be a permanent damage where the nerve gets damaged. In that case, there will be distortion of one side of the face. Fourth complication being, a few weeks after surgery, a small opening will be seen, which forms a fistula, small opening will be seen, and saliva can be seen flowing out, which is called a salivary fistula. And this too, it can be managed medically, it slowly stops by itself. In case it doesn't stop by itself, we need to do a small surgery on you. And next complication being, the whole area, this area, they will have numbness because one particular nerve may get cut because of the surgery. One important complication being a condition called Frey syndrome, which happens few weeks after surgery, and whenever the patient sits down to eat, he will get sweating on that particular area. So, this also can be managed medically. And to prevent this, sometimes we used to do small modification during surgery, so this doesn't come. This is one of the important complications which irritates the patient much. So, that also will be taken care of. And sometimes this flap or the skin can turn black in color because it loses its blood supply. If it happens so, we have to do a skin grafting. So, these are the common complications. So, about surgery, the name is superficial parotidectomy, and suppose we have planned for surgery for tomorrow. Tonight, have your dinner and at 12 o'clock, please do not take anything orally, no water, no fluids and no solid food. So, next day morning is the surgery. Suppose it starts by 9 o'clock, it usually finishes off by 2.5 hours and you are back to the room. So, surgery, how the incision, how we are going to open up, I have shown in the first diagram, and in the second diagram I have shown you a few electrodes being kept. These electrodes help us during surgery to identify the nerve so that we don't damage the nerve. That is what the electrodes I have shown in the second diagram. Now, after the surgery, when you come to the room, approximately next 4 hours, please, you will not be given anything to drink or to eat. Meantime, IV fluids will be going on and all the vitals from pulse rate, heart rate, and blood pressure, respiratory rate, temperature, and the soaking, if it is there or not, will be checked by the duty sister. and the same time IV antibiotic and painkiller will be going on. So after 4 hours you can have something fluid, plain water first, and if you don't vomit you can start drinking taking fluid, and that particular day you will be given only fluid diet. Next day morning it is going to be plain diet, normal diet. Now during surgery, to prevent blood formation inside, we usually keep a small drain. It can be vacuum drain or it can be glove drain like this. So subsequent day morning I will remove, or we will remove off the drain, and we will give a pressure bandage. So this is how the drain is removed, and once the drain is removed, the wound looks like this, and we'll put a pressure bandage and the patient is discharged. Now the discharge advices, we'll give you a course of antibiotic, say for 5 days. You have to take it one in the morning, one in the night after food, and we'll prescribe at least 5 days of antibiotic, 5 days of painkiller, but you need to take only for 2 or 3 days, and after that if you have pain you can take one. And you have to keep the wound clean, you should not soak that area, and if possible go to the nearest good clinic so that you can change this and apply a new bandage. And if not possible, you come to us and we'll do it. So the stitch will be removed only on the 7th day, that is the review day. So when you come back for the stitch removal, we'll see the wound is healthy or not. If so, we'll remove all the stitches, and same day the biopsy which you have sent for the specimen which you have sent for histopathological examination, the biopsy, the report could have come, and we'll hand over the report also to you. Now at home you have to take regular water, lots of water, 2 to 3 liters, and you have to ambulate a lot. Don't sit in one place, but you should avoid doing heavy work, and you can move your neck normally. That is, these are the usual things to be done at home. See to it that the wound doesn't get wet. And one more thing I want to tell you, that some of the patients, or most of the patients, they complain of pain in the throat. We have not done any surgery in the throat, everything is here. But why pain in the throat? Because of the intubation tube. The anesthetist will put the tube, because of that irritation that will stay for 4 to 5 days. And this has to be, it usually goes off in 4 to 5 days. And most of them, they complain tightness of that particular area also. That also stays for a few weeks sometimes. So these are the complaints I told you. Now after discharge, the review for stitch removal and to get the biopsy report is going to be 7 days by the surgeon. So you do a review to me, or the surgeon is going to give 7 days. Meanwhile, at home, suppose you develop any of these, please do not stay at home. Call us immediately and come down to the hospital. So these are, you get increasing swelling of that particular part, 1. You get severe pain in that part and you feel it is increasing in size, 2. Third is, you have disfigurement of the face. That particular side of the face is not working properly. You are not able to close the eyes properly, and there is deviation of the angle of the mouth. 4. You have a pricking like sensation inside, and that is troubling you a lot. 5. You are not at all able to move your neck to the left or right. And if you have any of these, you have to come back to us immediately. We will open up the bandage and see, and we will do whatever is necessary for you. So the early diagnosis and early prevention is better, so that it doesn't go into big complication. So this is how we manage a case of Warthins tumor.